Hello everyone, my name is Myke. Some of you all may know me as Mike, or even Mr. Myke 2010 from my own YouTube channel. Today's topic is testosterone therapy. I am going to share with you some of the information that was provided to myself and my chapter members during a workshop that was presented to us last Tuesday, June 11, 2013. Now, we had our accounting meeting right before the workshop. It was a coincidence, and it was just it was awesome to be able to have our monthly support group, which we do every second Tuesday every month, and Black Transman Inc. hosts this uh, support group nationally. So again, my chapter, we had our support group as as we normally do every second Tuesday, and it was just a major coincidence that this workshop was being held immediately after our support group. So again, uh, the workshop was testosterone therapy, presented by a pharmacist, 4-year intern, and the pharmacist who was supervising the intern, he's a CVS pharmacist, and he's a very awesome ally to the transgender community. I know him personally, and it was an honor and a privilege to take part in this presentation that he and his intern had put together. It was a very nice experience, very empowering. Now, I did do a video from the slides from the PowerPoint presentation that they did use during their workshop. It was awesome. They did give everyone copies of their slides, and at the end of the slides, there is a reference which has a lot of the sources they use to find a lot of information. So if you just happen to be interested in doing further research on your own time and you need some direction and you want to look into their references, feel free to reach me, inbox a message, and I'll be willing to share some of their references with you. Now, yeah, the video that I had before this one was very dry. It just didn't, it just wasn't my style. So I've decided to redo this video and be a little bit more relaxed and have it in a more so of a one-way conversation style. Yeah, so to you guys who are new to your medical testosterone transition, there are some things that I will share with you specifically. Some things that you should look forward to within a certain time frame. Not to say that these things apply to everyone, but this is just a general uh, guideline to kind of look forward to some positive effects that you may be looking for, or even some effects that you may not be looking for, just to know if it's normal to see certain things at a certain time. Things such as the 3 months. Within 3 months, you should be experiencing an increase in your libido, or also known as a higher sex drive. You may notice changes in your skin, the texture of it. You may notice increased muscle mass. You may notice fat redistribution, which means that the fat in your body may begin to move in different areas of your body. Let's say your hips and your buttocks. The fat there may shift to your stomach or shift somewhere else, but it's just not gonna necessarily be where it started. And also, last but not least, one of the major things that a lot of guys look forward to is the disappearance of your menstrual, if you have one. So look forward to some of these changes to happen within 3 months. Now, some things to look forward to. Give these things at least a year to look forward to them, okay? Things such as a change in your voice. A lot of us look forward to a voice drop. You may notice some genitalia growth, and it's even possible to experience male pattern baldness. So within a year, you may experience some of these things. If you have been on T for 3 months and you haven't noticed a change in your voice, give it a while. Give it a while. Again, 3 months may be too early for you to experience some of the things that I mentioned. But these things do vary from person to person. Now, some precautions to look for, alongside your medical provider, which is one reason why it's very essential to have a doctor, to be up under a doctor's care to help you look for things that may not be so healthy. Things such as uh, insulin resistance. You may have lipid disturbances, and you could experience uh, increase in weight, which isn't necessarily a bad thing. That's very common. With gaining muscle mass means that you may gain weight. Your numbers may increase due to how much muscle mass that you may get, and even you may even gain more body fat as well. It just depends on the person and their diet, exercise, and their genetics and things of that sort. Also, it's known that your blood will thicken, which increases your cholesterol. So if you already have high cholesterol pre-T, know once you start testosterone, you're more than likely going to have higher cholesterol because your blood does thicken. So be very careful, which is, again, another reason why it's a great idea to be under a doctor's care, because you can't look at yourself and see what your cholesterol level is. You need a doctor's help to assist you with that information. Let's see. Yeah, so let's talk about a good range for your testosterone to be is between 500 and 700. So that's kind of like the goal, is to be in that area. You could be more than 700, and some guys are under 500. However, just to throw out an idea of a good range, it's typically between 5 and 700. Now, in terms of knowing your T levels, your hormone levels, period, it's very good to be aware of your estrogen levels and your testosterone levels. And it doesn't stop there. A lot of us have been under the impression that our T levels are the determining factor of whether or not our transitional effects are where they need to be. Well, there's a thing called total testosterone, and then you have free testosterone. Now, the difference between the two is like basically total testosterone includes your free testosterone and also your bound testosterone. My understanding from the presentation is that bound testosterone is basically testosterone that works on the outside of the cells. Free testosterone is the testosterone that enters the cells. Now, that free testosterone that enters the cell is the testosterone that we look forward to doing the magic that we're waiting for. Like, the male characteristics, the voice drop, the hair growth, genitalia growth, even the male pattern baldness, the hair loss. Those are some of the things that are affected by free testosterone. Bound testosterone is not doing any of those things. So back to what we were talking about in terms of bound and free testosterone. Now, bound testosterone is 97 through 99% of your total testosterone. Free testosterone is between that 1 to 3% of your total testosterone. So your numbers could be 500, 600, 700, 900. It could be all of that all at once. But what really matters is your free testosterone. Now, if you get to a point where, most of your bound testosterone is, again, it's supposed to be the majority. Like I said, 97 through 99% is bound. But what if 100% of your testosterone is all bound? You don't really have any free testosterone, or you only got 1% free testosterone. So it may not be doing as much as we'd like. So 1% through 3% varies from person to person. Now, this is one reason why it's not a good idea to compare your numbers to the next guy's total testosterone numbers. Everybody's numbers are unique to their own bodies. So, another interesting thing pertaining to the free testosterone and the total testosterone. One reason why it's not safe to assume that your numbers mean everything is because you have guys who have lower testosterone numbers, but their physical attributes are very male, very prominent, and sometimes the effects is that's what we're looking for. Looking for the physical changes, not necessarily the numbers. If it was only based on numbers, none of us would really transition. It's about what we want to see visually. So if you see, you know, visual characteristics that are progressing and your numbers may not be as high as the next guys, don't worry about that. As long as you're seeing progress, which in the mirror, that's what matters. That's what matters. And what also matters is that your numbers aren't going too high. You're not, at 2,000 and, something like that. And now you have a menstrual cycle, or your numbers may be 700, which is supposed to be safe, and you have a menstrual cycle. That says your numbers don't mean everything. Okay, well, you have a menstrual cycle, so that means that something's not right. So then your doctor should then maybe try and manipulate your dosage. So again, to summarize what I just said, basically know that there's a difference between total testosterone and free testosterone and bound testosterone. Free testosterone plus bound testosterone equals total testosterone. So if you can, talk to your doctor and see if he has a breakdown of what your free testosterone is, just to give you a deeper look into what your numbers are and the differences between them. So yeah, I found that to be very interesting. I've always heard of free testosterone. I didn't really know what that meant. I never really heard of bound testosterone, so I really didn't know what that meant once the presenter mentioned that. So that was uh, very empowering to know that, and also to know that there's testosterone that does make it into the cells, and then there's testosterone that doesn't even go into the cell, that doesn't really give me the effects that I'm looking for from my tea. So that helps me understand a little bit better how the testosterone works. Also, let's see. We kind of spoke about the fact that there is a lack of long-term data regarding FTM transgender individuals. Because there is no long-term data, we kind of have lots of unanswered questions. And know that every doctor doesn't always have the same technique. So keep in mind that your doctor may not be 100% sure of what your transition uh, may consist of. You can't necessarily, you can try to ask your doctor, well, am I going to get facial hair? You can try, but your doctor's not going to have the answers to that. You can ask your doctor, well, what are my numbers going to be? Your doctor is not going to know that. Your doctor is handling you on a person-to-person basis, and everybody's transition is not the same. I asked the pharmacist about places to do injection sites, or like what's a good injection site. The pharmacist highly suggested using the glutes. Use your behind muscles, your butt. Those muscles in the back uh, were the most appropriate muscles to use according to the pharmacist. He said that those tissues there just absorb the testosterone better and distribute it throughout your body better than any other muscles on your body. And he also said if you are going to inject in your thigh, do not inject on the top of your thigh. He suggests using the outer muscles on your thighs, not the muscles on the top of your thigh. He's saying that those muscles aren't as, it doesn't have the proper consistency or the same consistency as the muscles in your butt. The muscles on the top of your thighs are a little bit too firm and may not absorb the T the same way as your butt. So you may have different types of changes depending on, or changes, you may have different types of uh, results depending on your injection site. So that's something to keep in mind. And also, I asked him about having a hysterectomy versus not having a hysterectomy with the long-term use of testosterone. And basically, uh, he concluded that if you are not going to use those organs, then, and if you don't want those organs, it's okay to get rid of them if that's what you want to do. It's okay to get rid of them, and you just take your testosterone and just go on with your life. Even if you have to come off, because I asked, well, what if you have to come off of your T and you've already gotten rid of your reproductive organs? Is it safe to just still continue living life without reproductive organs and without further use of testosterone? He said there is no current data right now stating that uh, it can be harmful uh, to, or safe to assume that your health is gonna instantly decline because you're not taking T and you've had your reproductive organs removed. It's okay. Also, he did mention that if you do decide to continue to keep your reproductive organs and to have long-term use of testosterone, just be informed or aware of the fact that your chances for health complications do increase because you are still on T. And to throw a number out there, he said, If you do want to get rid of your reproductive organs, try to do it within 5 years. Once you step into the 5 to 6 year range, your chances start to increase in terms of possible health concerns. So those are some things to consider. Again, every man's journey is his own. You're not less of a man or more of a man if you do keep your organs or if you do get rid of them. Only get rid of your organs if that's what you want to do. If that's the best for you and your decision, then that's what you need to make. Don't let anybody pressure you into doing something that you're not comfortable with. Ways your pros and cons of deciding whether or not you're going to get your reproductive organs removed, and go on from there. He also made somewhat of a public service announcement. I wish you guys could have heard, but I'll be more than willing to share his PSA with you. One of the quotes that he did say was, when you're not seen, you're not going to be properly taken care of. And what he meant by that was, when you're not visible, when you're not recognized, when you're not accounted for, it's pretty challenging for the healthcare field to provide the answers that we seek, because we, as transgender F to M uh, testosterone taking individuals, have the answers, have the data within us, and they need that from us to see how things are going, so that then future generations could have the answers that we don't necessarily have right now. We did have a discussion after the workshop. There were people that asked questions. We did talk amongst ourselves, and there were several answers that none of us had. There were several questions that we asked, and none of us had the answers to them, which does prove the pharmacist's point to the T. There are answers that some of us just do not have, and no one has them, or there aren't enough studies done to give proper answers. He said that we're one of the only population groups that have so many questions that go unanswered, because basically our population group is just totally overlooked. He did mention that as a healthcare professional, he does know for a fact that we need to step up a little bit more. So he's definitely urging for you guys to be a little bit more visible, to be as visible as possible, to speak your concerns, to reach out to those that can possibly help you, and to document everything that needs to be documented. If you get headaches every Tuesday and you think it may be testosterone related, write that down. Tell somebody, so that other people who may have that same thing, they can write that down. And then we could say, like, okay, 1 every 3 trans men experience headaches after the 3rd year of testosterone. We don't have things like that. So we need you. He needs you. All of the medical professionals need you, us, we, to talk to each other, to uh, attend workshops such as that one, and to share as much information possible so that they can begin to collect more data, so that they can better help us, so they can have better forms of testosterone, so they can have just other different options for us. Doctors are afraid, and we all came to the conclusion at the table, at the workshop, we've come to the conclusion that many doctors, of course, they're practicing, it's a practice. So, we're one of the population groups who are pretty new, and, a lot of doctors don't have that experience, and they're getting that through us, the ones that are now taking T. We are that population group that they're learning from. Some doctors fear changing your doses. Some doctors may not do it because they have that that anxiety of, oh well, what if something goes wrong, because I don't have these answers as a doctor. Many doctors aren't gonna say, you know what, patient, I don't know. Many doctors aren't going to say that. Many doctors are going to give you, some type of answer, or leave the question unanswered, or go around it, because they're not going to flat out say, I don't know. Then you have some doctors who will say, you know what, I don't know, but I can try to find out. But these are some things to be aware of. These are some things to uh, keep in mind. There are plenty of other new products, or products that may not be new but aren't as popular as the IM injections. The pharmacist and the student did mention that they do not suggest any oral tablets in form of testosterone. No oral tablets. Those are known to be very hard on your liver versus the IM injections and the gel and the roll-on. Um, he lightweight spoke about the pellets. The pellets that are implanted in you, they last several months depending on what your dose is, but they're very expensive. They cost a couple $100s per pellet, and you're normally going to get several pellets implanted in at once. So you're looking at a nice pretty penny if you choose to go that route. Also, the gel is known to be expensive, especially if your insurance doesn't cover it. The most inexpensive option right now that we discuss is the injections. And be careful about the size syringes that you're using. Uh, yeah, change your needles regularly. Every every injection that you do, you need to use a clean, brand new needle. That's what the pharmacist said. Uh, Also, syringes that are made for insulin, those little tiny syringes. He said that he does not suggest using those. Those are not intermuscular needles. He said those needles could even break in your leg if you're not doing it, and if they're just not adequate for what we're trying to do with them. So that's pretty much the bulk of the information that was relayed to us. I hope you're still watching. I hope you haven't fallen asleep. But if you have any further questions, I could try to answer to the best of my ability. Uh, Stay tuned for more information about this topic, because I will be attending more workshops that the pharmacist will be having, and I'll be in communication with them. So if you guys have any questions specifically that I haven't answered thus far, feel free to reach me, and I can see if I can find the answers for you. Keep in mind, every question doesn't have an answer right now, but some of the questions do have answers. So feel free to hit me up. Um, yeah, I think that's just about covers it. I hope this video helps someone. Please share the video with others, especially new guys who are thinking about starting tea. Uh, is very important for them to watch this video, and even people who are taking tea and they're just taking it because somebody told them they should take it. There are people out there like that. So I think people like that, you all should very much so be informed, because 9 out of 10, a person that's encouraging you to take testosterone against your will, they don't know that it can definitely increase your health health challenges. So those are some things just to keep in mind. But thank you all for watching, and I look forward to meeting with you all again soon. Take care. Peace.